Hello, welcome to Time with Terry, coming to you from the Space Coast of sunny Florida, where we have the beautiful Atlantic Ocean, lovely rivers, see rockets in the sky, and hear that tremendous sonic boom. I'm Terry, a retired rehab care professional who has worked with seniors my entire career. Now I'm at that stage in my life. In this Outlet Time with Terry, I would like to hear your ideas and share your concerns because to me, this is not just a podcast. It is my mission as a senior advocate to connect you with an amazing network of resources because in Brevard County, we care about our seniors. I would also like to support small local businesses and charitable organizations. So, today, my trivia question for the day is what year did Medicare start? Now, the reason that is the trivia question is because I am delighted to have Vicki Moore from Moore Insurance Solutions. She is a licensed insurance agent and works with, you help people, you help individuals and their families navigate healthcare coverage. You specialize in Medicare, and you also work with people under 65
I do.
with their health care coverage. So welcome to Time with Terry.
Well,
nice to have you.
Thank you, Tara. It's so nice to be here with you today.
Thanks. Okay, so your background. You're from Indiana,
I am.
a good Midwestern.
Yes.
Yes, yeah. And you went to college at Purdue University.
Yes.
And Georgetown University for special ed.
Actually, Georgetown
Was it
College.
college?
There's a
I'm sorry.
difference.
Okay.
Georgetown University is in Washington. I am. Yes, this
Okay.
was is a small private college in Kentucky. But yes.
Okay, great. And you have 3 children. And great. And some of your children lived overseas, which is nice. Your daughter lived in Ireland. She married somebody from Ireland?
Yeah, somehow I ended up with basically 3 travelers. So my oldest daughter, Shelby, she did several study abroads, and that took her eventually to Kurdistan, where she taught English to first graders, and that's where she met her Irish husband. And so she lived the last 4 years in Ireland, Dublin, and then Galway. And she's back in the States, back in Indiana. So I'm thrilled to have her back. But I did get to do some fun visiting, while she was overseas.
Yeah.
Yeah.
Ireland, yeah, I hear it's beautiful. I hear
It
it's
is.
absolutely beautiful there.
Yeah, and then my son and his wife and baby, my 2-year-old grandson, they are in Germany right now. They live in Weiden, Germany, which is Bavaria area, about 2 hours south of Munich. But he's in the military, and so that's why they're there. And it's we had a nice visit with them over the summer. They came back for a few weeks, so it was nice. But yeah, it's not like I get to see my grandbaby every day or every month. But yeah, so they're enjoying their time overseas.
Nice. Well, it's nice that you have a place to stay. You can go overseas, and because Europe is wonderful. I went to the Netherlands, and beautiful. Yeah, in Germany.
But I haven't made it there yet.
Yeah,
Yes.
it's beautiful. Yeah,
Okay.
but it's nice. I know it's nice being affiliated with the military, though, too. You know,
Yeah.
when you go overseas. So wonderful.
Yeah.
You always have places to stay, which is great in your travels.
Yes, I do. And I should, just because I don't want to neglect my one other daughter, but she's in Tampa, my other daughter. She's my middle one. And so I get to visit the west coast of Florida every once in a while as well. So,
Good. Well, that's
yeah.
good. You have one that's close to you.
A little closer.
Close by. Yeah.
Yes,
Yeah.
So that's nice.
Great. So you have been an insurance agent for 13 years, and you decided to go independent in 2021. So what made you decide to become an insurance agent?
It kind of just happened on a fluke for me. I was a special education teacher, and of course, as a teacher, you get your summers off. And so I had a friend that was in the insurance business, and she was working with supplemental insurance, which is basically, Medicare supplements or your accident policies, your hospital indemnity policies, anything supplemental. So that's how I kind of started with the company, that type of a company, and it was a good old fashioned door knocking company. So I was knocking on doors, and that's kind of how I got my foot in the door with insurance. And then there was a point I was living in Indiana, and there was a point where I decided I wanted to follow my best friend to Florida. And so I came to the Melbourne area, and upon recommendation, I sought out the local manager of Humana here, because Humana, the headquarters for Humana is in Louisville, Kentucky, which was basically in my backyard. So I grew up with Humana, but it was a great company, and I sought out the manager here, and he hired me, and so I moved here in 2018 to work for Humana.
Nice. Very
Yeah.
nice.
Yeah.
Yeah. Well, when you go on Medicare, I went on Medicare 2 years ago. I turned 65, and people, I just thought when you go on Medicare, you go on Medicare. You just sign up for Medicare, and people said, you need to really have 3 months before your Medicare kicks in, because it's there's just a lot. And I was like, oh, it can't be that bad. And then when I started to, I didn't know you at the time. I wish I did. I wish I did. It would have been nice. But when I sat down with somebody, I was like, oh my goodness, I had no idea how complicated it can be. I mean, there's like so many. There's Advantage, there's a supplement, and so you have to do what's best. But there's like an alphabet of things. Like there's Med A. So if you could explain to us like the different I don't know plans, but the different parts of Medicare, like Med A. Med A covers.
So basically, your Part A is going to be your hospitalization. And so when I sit down with somebody, especially somebody that is new to Medicare, like you were 2 years ago, when everything is just kind of foreign because it's a lot of information. So I like to sit down with somebody and let them, just share all the information. So your Part A is your hospitalization, and most people do not pay for Part A. So all the years that you've put in, if you've worked your 40 quarters, then you've earned, you've paid your FICA taxes. So that is what is affording you to be able to get your Part A at no monthly premium. Your Part B is a different story. Your Part B is going to be your outpatient visits, your doctor visits, and things like that. Your Part B does cost money, or there's a monthly premium for it, and it just depends. The average amount in 2025 is $185. Now that number changes every year. The Center for Medicare Services sets a new rate for that every year, and they have a predicted cost for that right now that will it's not set in stone yet. They'll know more, and I think probably in the middle of November is basically when they will set that exact. But they are predicting it's going to go up from the 185 to 206.50. That's what they're saying.
Really?
Which is it's over an 11% increase, which is the highest increase that they've had in about 4 years.
Okay.
So, just like everything else right now, it's inflation, I guess. So everything's unfortunately kind of going up. But so the Part B is your outpatient services. So you have to have your Part B though, if you want to enroll in, whether it be a supplement and a drug plan, a standalone drug plan, or if you want to go with an Advantage plan. But, when I sit down with somebody, I want to share that they've got options. They can go the original Medicare pathway, or they can go the Advantage plan pathway, and just explain, the difference between the two.
And then if you decide with Med B, if you decide you don't want Med B, then there's a penalty per year.
Yes.
If you don't start with Med B, then the next year there's a 10%. If you could explain that.
Yes. So that's why it is so important when you are turning 65 is to talk to somebody. If it's not me, talk to somebody local in the community that can explain these, because lots of people how this works, because lots of people, I don't want to say lots, but I definitely run into people that, never realize if they don't take their Part B that they get a penalty. So for every month outside of your initial enrollment period, beginning month 7 or beginning month 8, you start to accrue a penalty of 1.1%. And so for the year, that amount, if you go a 12-month period, that amounts to a 10% penalty. So right now in 2025, the amount is $185. That's your premium. So if you went the whole year without it, you would have an $18.50 penalty. And year 2, if you went without it again for the whole year, it's going to go up to 20%. So it just keeps accruing and it never goes away. And I will also add, same thing with Part D. So if you don't take your Part D, D is for drugs, that's your prescription drug coverage. If you don't take your Part D, you also begin to accrue a penalty. And I will tell you that happened with my own father. Now, my dad, let's see, he is 78, going on 79. And so, I was not in this business when he began Medicare, so I knew nothing about Medicare at that time. And so he went into it thinking, I'm really healthy. I don't need to have a drug plan. So he went with the supplement. He stayed with the original Medicare. He had actually added a high deductible supplement. We've since changed that for him, but he never went with the drug plan. And so so if he did, by the time I got into this business and, we're reviewing his information, I said, oh, you don't have a drug plan. And he was like, and at that time his penalty would have been pretty big. So he has opted to never take his drug plan, which is okay. For him, it's worked out, but there's a lot of people, we don't know what we don't know. We don't know what our health is going to be like, what medications we'll be on. So my advice to anybody is, when you're starting Medicare, definitely talk to somebody that can explain everything to you. But if you don't, and even if you haven't taken your Part D, definitely look into that, because it's something that you may want. And there are plans that it doesn't cost. If you go with an Advantage plan, most Part D plans are part of that. It doesn't cost you anything more to have it. Or if you have Original Medicare like you do with a supplement, there's a lot of drug plans that don't cost anything right now that are 0 monthly premium. So they don't even add a cost to you. Okay. So it's something that you definitely want to look at, so you don't ever end up having a penalty and needing that kind of a plan, needing your Part D plan.
I do have a, excuse me, I do have a drug plan, but I didn't realize there was a penalty for that as well.
Yes.
Wow.
Yeah, and believe me, I run into a lot of people that are very upset, like, nobody ever explained this to me. Oh. And it's interesting, because there's people that just feel like, they don't want to talk to anybody about the Medicare. I mean, plenty of people want to get educated, but there's people that just, for whatever reason, they just don't meet the right people. They don't talk to anybody, and they just really don't understand all the ins and outs of it.
Well, too, I think that a lot of people probably are like, oh, I don't need to pay for that. I'm okay, but not realizing that there is a penalty involved, and it accrues if they don't take that, if they don't add that to part of their plan.
Yeah.
So that's why it's so important to have somebody like you to sit down and explain all these things.
Yes.
Because it can get really complicated.
It does. It does. There's a whole formula on how they calculate that penalty, and it always follows you. So, for example, when I meet somebody and maybe they never had a plan, but they enroll into an Advantage plan, say it's through a carrier such as Humana. So when they enroll into that Humana plan, or the Advantage plan, I can see that, they did not pay their Part D for the last 20 months. So I know that they're going to have a penalty, based on that 20 months of not paying the penalty. So it follows them wherever they go.
And that continues. I mean, they pay that penalty for the rest of their life. Then it's not like they just pay it for a short period of time.
No, it never ends. It never goes away. Okay. And and I have people. I've talked to some really upset people. They're like, nobody ever told me. But you would think that maybe CMS would address that. CMS is the Center for Medicare Services. They're the ones that make up all these rules and set all these rates and all the penalties. I don't know that they'll ever address that. I mean, in the time that I've been in this business, I've never seen that penalty change for either the Part B or the Part D. But yes, for now, it is there. And we haven't really talked about the separate types of plans, but like with Advantage plans, there are different types. There are some that work well for people that don't have a drug, that never took their Part D. So those are an MA plan only, meaning Medicare Advantage. They don't include the drug plan. And a lot of those plans were designed for people that maybe are veterans and maybe get their medications through the VA. So they may not want to get their medications through their plans. But those kind of plans also work well for people that maybe never took or never realized that they needed to take their Part D. So there are plans out there where you don't have to worry about getting the penalty. You just would not get your prescription drugs. You would just still continue to do that on your own, but at least you wouldn't be penalized. So there are options. So there's lots of options for lots of different things. So that's why it's always good to talk to somebody and ask questions.
Good. And another good thing about you is like you're local, because there's just so many people on TV, and they could be in Wyoming or California, and they don't know the area. They don't know the hospitals and the doctors like you do, like someone like you does. And, because so many people have gotten ripped off by people, like that, because they just don't know the local, locally how things work or what is the best advantage for them.
Right.
Being local.
Well, and so as a local independent agent, that is probably one of my biggest frustration points is with, right now, and probably many of the people in your audience right now are getting texts constantly. I get texts constantly. It blows up my phone. seeing commercials and TV ads all the time, trying to get people, they're call centers, and they're trying, and they're licensed agents, but they work for large call centers, and they're just kind of churning out, they're just trying they're just trying to get your attention as best that they can. And oftentimes they're touting like healthy food cards, which a lot of people don't qualify for. There's different reasons you might qualify for those, which that's something we can talk about as well. But they're just getting, and they're not, they're just trying to get you to, if you don't qualify for one of those healthy food plans, they're just trying to find something that they can move you to, just so that you become one of their, that you become part of their system. And they don't always know your local well, they don't know the local doctors. They don't know how our system works here, with our hospital system. We've got a unique area here with the Health First hospitals, and not all of the hospitals are in network with all of the, if you have a Medicare Advantage plan. And so we kind of have a unique area. But I don't just work in Brevard County. I work, I'm licensed for the whole state of Florida and actually additional 12 states. So I do work out of the area as well. And I'm not saying everybody that you're going to work with over the phone is going to be a bad player, but it is nice to work with somebody that does know what you're talking about and is thorough and is going to make sure, those are important questions to ask. You want to know, who are your providers? What are your medications? What is the dosage that you take? Because you want to make sure the providers that you choose are going to be part of the plan that you choose. You want to make sure the medications that you need are covered, are part of the formulary of the plan that you're taking.
And your doctors, too. Are you able to keep your doctor?
Exactly.
Too? Are you,
exactly.
Right.
Yeah, those are all really important things. And that's the kind of thing that I work closely with anybody that I'm working with to be able to do.
Right.
So, yeah.
It's nice to know, what their diagnosis, what medications, who their doctors are, and what plan would be appropriate for them. And also I know that my friend Gina, who just loves you to death. She's like, Vicky was wonderful. She moved to South Carolina. So because she moved to a different state, you really helped her check out the plans there and helped her to decide to go on. She had to go on a little bit of a different plan because, things are different in South Carolina than they are here. So she just thinks the world of you. So I talked to her last night. And she goes, "Oh, I love Vicky. She was so good. She was so patient with me and sat down and explained everything." And so she said hi.
Okay,
Gina says hi.
Yes, she's a sweetie, and I hear she's loving South Carolina. So,
yes.
And that's how kind of I have become appointed in different states, is because I've had local clients like such as Jean, and she has. Because she was moving to South Carolina, I got myself licensed in South Carolina and did the work there to make sure she was getting on the right plan.
And also there's people moving from other states to Florida. So because they are moving from a different state, their plans could be a little different than in Florida. So if you have people from New York or wherever, things could be different from one state to the other. So that's good for them to sit down and talk to you to say, hey, what would, do I need to make some changes? Because I'm in a different state and, the system's different here.
And that is a very good point, because all over the country, there are so many different, a supplemental plan here in Florida can be a totally different price range in, say, Indiana. So rates can be very different. And then with Advantage plans, the markets dictate what those benefits look like. So they might be richer. I feel like here in Florida, we have pretty rich benefits. So I've had clients move in different places, and maybe they're not always as rich as they are here. And maybe that's due to our population here. We've got a lot of seniors in this area, and it's a competitive area. So the carriers are pretty competitive with what they offer, and maybe they're not always as competitive in other places. So I've definitely had clients that are like, "Oh, my plan's not as good in this state as what it was in Florida." Or, maybe in Florida, Humana was my best option, but in South Carolina, maybe it's United. And sometimes it's more of a local plan. Like here in our area, Health First is a really big plan. And, Health First is just in the state of Florida. So if you move outside of the area, you're not going to have a Health First plan. I just helped a family that it was actually the brother that lived in Kentucky, and his sister and her mother were all moving to Kentucky. And so I helped her brother that already lived there, and then I helped she and her mom. And
Nice.
they always had health first here, but clearly not
Right.
health first. So it was a whole different company. So it's just looking at what is what's what's going to offer the best benefits.
Which is which is wonderful, because I know when you're moving and you're like, oh my gosh, because healthcare, especially when you're older, I mean that's like one of the most important things is you want to make sure that you're covered. So that's great that you're able to do that for them.
Yeah,
Yeah.
and then actually her daughter and husband, the whole family was just up and moving to Kentucky to be near other family members. And her daughter and husband, her husband had worked for the city of Palm Bay and had great employer benefits, but he was going to be, he's still looking for his job there. So they needed under 65 coverage. So I helped them get set up there in Kentucky for the under 65. So, it just,
Nice.
it's the whole realm.
Well, too, and we were talking about the fact that if you have a couple that he retires, like the husband retires, and they had insurance under him, but now he's on Medicare, then his wife has to go, or spouse, it could be either way, has to have their independent insurance plan now.
Yes, so that happens a lot. So oftentimes, when you have a couple, maybe maybe the husband has worked for a company for years, and maybe the wife has been part of the company, the employer group plan, and then all of a sudden the husband's retiring. Well, then of course the woman, the wife cannot, or the spouse, whichever one it may be, does not get to stay on that plan anymore.
Right.
So then, there's a gap. So, we've got to fill that gap. So there's a few, there's the option of the ACA or the marketplace plans. Those are the government plans. So I can help somebody look at those options for that spouse. And then sometimes there's even could be better options with, other than that, which private plans. So I can look at all of those and just see what is the best option. And they're predicting, there's a lot of changes. Legislation has a lot to do with anything Medicare related or, health insurance related. So a lot of the changes with Medicare the last couple years came from the Inflation Reduction Act with the drug plan, with the changes with the drug costs and things like that. And then what is it, the new big beautiful bill? I think there's going to be some changes with maybe somehow how some of that is reflected. So they're predicting there's going to be some changes. So subsidies that people have gotten with the under 65, the ACA marketplace coverage may look very different in November. So that this is going to be a year of changes. So it's really a good year. Everybody should do it every year, especially whether you have a supplement with a drug plan or an Advantage plan. It's always good to review to be sure you're still at the best place, whether it is the drug plan or it is the Advantage plan or the ACA, because things do change. So it's always good to review your health coverage.
Yeah. So as far as like the changes, there are some changes coming.
Yes.
For next year.
Yes.
Yeah. The Med B's going up. You were saying Med B's
going
up.
The Part B premium right now it's the $185. Everybody's paying $185 a month unless you have depending on your income. If you're in a lower income bracket or a higher income bracket, that can vary, but the average is the $185. That is it's predicted to go up to $206.50. CMS will finalize that sometime probably in November. It's not quite finalized, but that's what they are predicting. Okay. What else is changing? So the Part D premium, so with Part D, and this came under, actually I think this fell under the Inflation Reduction Act, but so it was set for the most that you could pay for your drugs this changed in 2024. The most you would pay was $2,000 for this year. That is going up by $100. In 2026, it's going up to $2,100. And so the change that came with that actually was a positive change in many ways for people that took a lot of medications. So in the past, a lot of people, and I if you took a lot of meds, you might be familiar with it, but there was something called the donut hole or the the coverage gap. So that went away in 2025. So when you had that, people could have paid upwards of $8,000 for their medications.
Wow.
But that Inflation Reduction Act changed that, and they said nobody's ever going to pay more than $2,000. That was this year. Then next year it's maxing at $2,100.
Okay.
They also instituted a drug payment plan for people that had expensive medications, so that people could set up a payment plan to pay for their meds. And beginning this year, that's going to roll over, so you don't have to re-enroll if you have set up a payment plan. So they're trying to, I think they're, still capping the cost of insulin. I think for most insulin at $35, and I know they're negotiating, bringing down the cost of some expensive drugs. I don't know that whole list right now off the top of my head, but they're trying to come up with ways to kind of decrease the cost for meds. So
good.
But one thing that happened due to that this year is that, these companies, the carriers, they all want to, they want to make money. And so when they're coming up, because they're kind of covering those costs, the consumers, the beneficiaries are getting that benefit of the lower drug costs, but the bottom line is these companies still want to make a profit. So some of the benefits that we saw this past year maybe reduced a little bit. And every carrier looks a little different. They all, and I can't talk about specific benefits or changes for the upcoming year, but, maybe they decreased what their dental coverage was. Or one of the things that's really popular are plans that give back money. So there's Advantage plans that are give back plans, and so they reduce the cost of your Part B premium. So we talked about that being the $185, going up to the $206. So, for example, there's plans that might reduce your plan by $175. So instead of you paying the $185 every month being deducted from your Social Security, you're basically just paying $10. So you can save a lot of money that way. And those are really popular because they keep money in your Social Security check each month. But that's one area that maybe they reduce. I mean, and I'm not saying that's happening, but that could be a place where maybe they're cutting costs a little bit, or maybe you don't see as much in your vision. Maybe you're not getting as much for glasses or things like that.
The thing about Advantage plan, though, it's your premium. I mean, you don't have to pay anything, or it's low premium, but if you have to go to the hospital or you go to the doctors, there's a copay.
Yes. So so what I like to share with people when I'm sitting down with them is basically when you go with this, if you stay with Original Medicare, like is what you've done. So you've basically stay with Original Medicare, which covers 80%. Your Part A covers 80% of your hospitalization.
Right.
Your Part B covers 80% of your doctor visits. Things like blood work and those and labs and things like that. But then you've got that 20% that is not covered. So that's what your supplement or Medigap. It's the same thing.
Right.
That's what those fill those those supplement what Original Medicare does not cover. So you're paying a higher monthly premium every month to have those things, and you really have the most comprehensive coverage when you have a supplement. You don't have to worry about getting authorizations for the most part.
Right.
You don't have to worry about, okay, is my doctor in the network? As long as a provider accepts Medicare, you're going to be covered. So when you have a supplement, you pay your monthly premium, and depending on the plan that you have, there's a Plan G, there's a Plan N. Some people still have the Plan F. I've even run into people recently that have the Plan J. That's going back quite a few years. But, if you have the G or the J, they do not have a Part B deductible that you're responsible for. But be part of the legislation that went into effect on January 1st of 2020, they didn't allow the plans to pay for your Part B deductible. So the Part B deductible right now is $257. That is also, so you, for example, having a supplement, you pay your Part B premium of $257, and then after that, you probably don't, I'm not sure which plan you have, but you probably don't pay any copays. So that is a really nice thing about the supplements. You can predict what your cost is going to be. You know what your monthly amount is, and you just know anytime you go to the doctor, if you're hospitalized, you don't have any copays, anything to worry about.
Which is nice.
Yes, it's a very nice thing.
It's nice.
And
But the advantage is I know a lot of people that have the Advantage plan, and that's that's good for them. It just depends on the individual
Right.
that,
Yeah.
of the plan.
With the
Yes.
Advantage plans, you don't have the monthly premium. You pay your Part B premium. And then, and if you're not working, maybe you just get billed for it. It may not be coming out of your Social Security check because a lot of people aren't retiring as quickly. Maybe people are still working. So that's looks a lot different than it used to as well. But so on the monthly basis, you're not paying much, but you have the copays like you mentioned.
Right.
So you'll have a copay for hospitalization. You'll have a copay for a specialist. Pretty much everything that you do. I mean, there's some things that you don't, like your preventative visits and things like that. You're not going to have copays for. But what you can do with the Advantage plans is that you have what's called a max out of pocket. So every plan has a max out of pocket. So that if it's an HMO, lots of times HMOs have a lower max out of pocket than a PPO. So an HMO, maybe your max out of pocket is $3,200. So you'll never spend, if you have a catastrophic health year, in and out of the hospital, lots of copays, you'll never spend more than $3,200. That's your max. Maybe, though, with a PPO, you have more flexibility with a PPO because you've got a network, but you're allowed to go out of the network. You can typically use it all over the country if you need to or want to. They're really good for snowbirds, but your max will be higher probably. It could be upwards of 60. There's some out there for $6,400. And then if you do go out of the network, that number can even go up higher because you're going to pay higher if you go out of network with some plans. So those numbers can really change. So if you really calculate it, sometimes your supplement could be, if you had to pay the max out of pocket with your Advantage plan, you could actually end up paying less with a supplement.
Right.
So it comes down to math, really. It's good to kind of calculate.
Right. And you kind of take a chance too. It's like people are kind of taking a chance. Well, I hope I'm healthy. They're like, I'm pretty healthy. I don't need I don't need that. But you never know. They could be. There's 90-year-olds, 100-year-olds that are still in pretty good health, but sometimes things happen. You never know. You could have a stroke, a heart attack. There's a lot of things, but it just depends on the individual, what they want to risk and how they feel about it. So
right.
Yeah.
Well, oh, go ahead.
No, I was just going to say, it's good that you're up on all the changes and everything. How do you update yourself? Are there classes or you tell me about that?
We have to take a lot of classes.
I'm sure.
So, of course, you originally get your health and life license, and so I'm licensed, but you have to do continuing education. So, there's so many hours each year or every few years that you have to take. But the biggest thing, in addition to just the continuing ed that you must take every year, you have to do what's called the AHIP, and that is if you work with Medicare Advantage like I do. And so you take an AHIP exam, and then after that you have to do it for each carrier. So I think, what am I licensed with? Maybe 10 carriers, which all of the local carriers for Medicare Advantage plans, probably most of the prescription drug plans. And then so for each individual carrier, whether it be Humana, down south there's a company called Ultimate. All the different companies offer their own exams. So every single year I spend, typically opens up in June, end of June. So every year, for a couple months, I'm doing all of the exams. So I'm keeping up not just on the industry changes, but also on each specific plan benefits for each company, and so they're all
good.
So yeah,
so you're up to date.
Yeah,
you're up to date, and and you offer ongoing support. If any time they have any questions about anything, they can feel free to call you. And if somebody wanted your services, like what do they need to do? What would be their first step?
Well, they can reach out to me. I can be reached at, you want me to give my number?
Sure.
Yeah. So 321-272-0218 is our line. And My office is located at the Helping Seniors Resource Center, which is at 1344 South Apollo Boulevard, Suite 2C. And I will say that I'm really proud to be part of this organization. I am on the board of Helping Seniors of Brevard. And so I do a lot with that organization. And there's several of us that work with seniors that have our offices located here.
Right.
And so it's a really great place, a really great resource for our senior community.
Right. Yes. Helping Seniors of Brevard. Yeah, it's a plethora of resources, which is so nice. And it's very conveniently located here it's near Holmes Regional. And this is a good place to come for resources.
Yeah. And I will add, so you can reach me by phone. I do appointments here at my office, but I also come to you. So if somebody needs me to come out to, I do home appointments, so I'm happy to meet you there as well. Mm-hmm. Yeah, and I will say I've got an agent working with me as well.
Kara.
Her name is Kara Davis, and so she's come on with me recently, and she's wonderful. So you've got options.
Right. If they want to look you up on, or are you on Facebook as well?
I am on Facebook.
Okay.
Yes.
Well, that's good.
Yes, More Insurance Solutions.
Mm-hmm.
Yes.
Good. Well, the trivia question for today is, what year did Medicare start? So, Vicki?
Okay.
You can guess.
Yes. So Medicare began I believe it was July 30th, 1965, under Lyndon B. Johnson. He was president at the time.
Okay.
That's when it began.
Wow, that's great. Now, is there anything that I didn't cover that you would like to mention?
I feel like we've talked about a lot today.
Yes.
So I think what I want to emphasize more than anything is there's going to be a lot of changes this year. It's really important. If it's not me, talk to somebody, preferably local, that like you mentioned earlier, that does know the area and the doctors, and just review your plan. That's the most important thing, whether it be your drug plan, if you have a supplement, or your Advantage plans, because they're gonna all look. There's going to be a lot of changes this year. So that's the most important thing. And I would say if you're working with somebody outside of your area, make sure it's like somebody that's not a call center, that's somebody that is a good agent with integrity. Because it's not the end of the world, but I would ignore those crazy phone calls that you're getting, because those are the ones that I just wouldn't trust.
I know.
That's just my opinion.
They just don't know. They just don't know the area, and they don't know the doctors, and you're up to date on that. It's very obvious that you're up to date, and you take a lot of care into what you're doing, and to inform people, to properly inform us of what's going on in our area and what would be the best plan for us. So I appreciate that. We appreciate, all that you do, and I need to make an appointment with you. Okay. I'm going to make an appointment so that you can review, at least, just to review, because, maybe there are some changes that I could make that would be better for me. So yeah, I'll be giving you a call.
Okay. Well, I'll be happy to review it for you.
Good. Okay. So the quote, actually, I have a couple of quotes.
Okay.
This is from Anonymous, but it says, age is simply the number of years the world has been enjoying you. Isn't that cute? That's cute.
That.
And then Jimmy Buffett. This is from Jimmy Buffett. Wrinkles only go where the smiles have been, which I think is cute. Yeah,
yes,
it was cute. I know I was going to get a quote about Medicare, but I couldn't find anything about Medicare insurance. So I thought, well, something on aging.
No, I love it. Those were great.
But it's really cute. Well, Vicki, it was great having you, and informing us of the services that you provide, and so if you need somebody to sit down with you, and if you're new, or even if you've had Medicare for a long time, you can give Vicki a call, Vicki Moore at Moore Insurance Solutions. So yes, so it was nice spending time with Vicki, and I look forward to our next episode of Time with Terry. And just a reminder, reach out to somebody and be a blessing, and you'll be blessed too. Bye.